Coming up next on Making Moves, the battle against COVID-19 continues. We'll tell you how JTA's partnership with the Mayo Clinic is helping expedite coronavirus testing. CEO Nat Ford tells us how this crisis is affecting the agency, what safety measures JTA is taking to keep everyone safe, and JTA Cares reaches out to some local businesses to help get them through this pandemic with their business intact. I'm Bill Milnes. These stories and more right now on Making Moves. Hello and welcome to Making Moves. I'm Bill Milnes. As you might imagine, much of our show will be dedicated today to the coronavirus. We will show you the many measures JTA has been taking to keep both its customers and employees safe while still trying to provide transit service to the local community. How the JTA is helping local restaurants stay above water, and we'll show you how JTA used a 3D printer to help fight off the coronavirus. We begin though at the Mayo Clinic, but not for reasons you might think. As most of our viewers know, we talk a lot on this show about JTA's plans to incorporate autonomous vehicles into the transit network here. What we didn't expect was to be talking about it again, now, during a pandemic. But the COVID-19 pandemic is exactly why we are talking about it. As fear, confusion, and uncertainty gripped our community, the nation, and countries across the globe, JTA and the Mayo Clinic were busy finding a solution on how to expedite coronavirus testing using autonomous vehicles. So let's go over to Studio 2V now, where we're joined by Making Moves senior correspondent Eugene Lindsay. Eugene, both Mayo and JTA are known for making headlines in their respective areas of expertise, but this is news on a global scale. Impressive no matter how you look at it.
Yes, Bill, you're absolutely right. What Mayo and the JTA were able to accomplish here using autonomous vehicles to expedite the coronavirus testing process was a remarkable feat and a true example of the forward-thinking and pioneering spirit of both companies. And like you said, Bill, it's getting attention around the globe. The Jacksonville Transportation Authority and Mayo Clinic are two companies that are widely known for leadership and innovation in their respective fields. Now the two have joined forces in the fight against the COVID-19 pandemic. When Mayo Clinic in Jacksonville, Florida began offering drive-through testing for the coronavirus out in a distant on-campus parking lot, the JTA saw this as an opportunity to play a key role and partner with Mayo to help flatten the curve in this pandemic.
JTA approached Mayo and said, would there be any interest in using 4 of these autonomous vehicles that they had in an effort to transport supplies on our campus. And so that resonated, and within a week from that first phone call, the autonomous vehicles were deployed on our campus and transporting samples, COVID samples from our drive-through testing facility.
Everybody really jumped on it pretty quickly, recognizing the impact this could have, recognizing the magnitude of the current COVID-19 pandemic, and that this could be something that can really help the situation here in Jacksonville and on the Mayo campus. And so everybody really stepped up pretty quickly.
So the JTA team quickly set up a mobile command center on the Mayo campus to monitor the operation, and then called in a couple of their key partners to lend a hand. Navia, a French manufacturer of autonomous vehicles, assisted with route configuration and software installation. The company's CEO says the opportunity to work together with these organizations in an effort to provide a dedicated COVID-19 testing solution represents our goal as a company, and that's to create a more accessible solution in the moments that matter, whether that be crisis, shortage in manpower and resources, or other areas we can't provide aid in. Also, autonomous vehicle provider and solutions company Beep supplied 3 of the 4 AVs that are being used in this project.
It's so important you can pull together a public-private partnership like this, where you see industry coming together with the public entity here in the Jacksonville Transportation Authority in the city of Jacksonville, coupled with Mayo Clinic and our other technology partners. It's really it's awesome to see what we can do in a very short period of time when we get all aligned behind the same goal.
The goal here is to get the test samples collected from the parking lot to the lab quickly and with minimal contact.
We have a limited staff on our campus who are embroiled in caring for patients. And so this represents an opportunity for us to help them not only with the transportation of these potentially contaminated specimens to our processing laboratory, avoiding unnecessary exposure of the virus to our staff, but also freed them up to do more important things.
One of the key goals of what we're doing is to further reduce any exposure that humans may have, medical professionals may have, in transporting these samples. And so we are operating in what's called autonomous level 4, which basically designates that we're operating in a very safe environment, but with no driver on board.
COVID-19 team stand by for launch, giving command to Navia now for deployment.
The journey from the collection site to its drop-off point in front of the Vincent Stabile building takes about 3 minutes to complete. While the vehicle may travel in a completely autonomous state, it is programmed to recognize any obstructions and can come to a complete stop should anything crosses its path. And while on this pilot project on the Mayo campus, an extra measure of security accompanies each run. An escort vehicle trails just behind the AV, and attendants roll along on scooters to ensure its safe arrival.
I think this is a really good use case as we move forward with the Ultimate Urban Circulator project, especially as we look to develop and deploy a fleet of autonomous vehicles downtown in the urban core of Jacksonville. So by taking an innovative and a very bold approach to leveraging autonomous vehicle, artificial intelligence, and machine learning to actually transport COVID-19 specimens on the Mayo campus, we're able to interact and see and understand in real time how the vehicles react to some of the things that we may see in the future as we deploy our project in the downtown urban core.
This particular project really has generated a significant amount of interest, not just within the institution and across the enterprise, but even nationally and internationally with a lot of interest. I think our Arizona and Rochester colleagues are particularly interested to see how this works out for us. There's certainly interest in perhaps deploying similar kinds of technologies on those campuses too. So I think that it's been a resounding success. I think that what this has allowed us to do is, in a very real-world way, test the feasibility of using these autonomous vehicles on our campus. And it's also allowed JTA the ability to actually deploy them in a real-world setting too. So I think both the JTA as well as Mayo are obtaining really important data to help us understand how we can deploy these in the future.
So, Bill, I think the broader topic here and what I was struck by most is Mayo's and JTA's commitment to innovation and caring for people in their respective fields. The JTA on being on the cutting edge of transporting people and serving the community, and Mayo Clinic being at the forefront of identifying new and better ways of caring and meeting the needs of people and their patients. This is a wonderful example of ingenuity and partnership on behalf of both companies, particularly when it comes to joining forces to do whatever it takes in the fight against the coronavirus pandemic. Bill?
It's really remarkable how quickly this initiative all came together. Congratulations to everyone at JTA, the Mayo Clinic, Beep, and Navia for this remarkable achievement. Technology and ingenuity at its finest. Eugene Lindsay, thank you. Great job as always. Well, the coronavirus impact on JTA, its employees, customers, and you, our viewers, has no doubt been significant. All non-essential persons throughout Northeast Florida and across the Sunshine State have been working from home after Governor Ron DeSantis issued a mandatory stay-at-home order. The JTA has been running on a modified bus schedule since the early stages of this pandemic, with a goal of providing as much coverage as it could while still keeping everyone as safe as possible. Those decisions were evaluated daily at the highest levels of JTA leadership, either on conference calls or via online virtual meetings. To learn more on how JTA has been adjusting to this emergency and the toll it's taking on the authority as a whole, I sat down today with CEO Nat Ford.
Let's start with the obvious. How are you and your family making do through this critical time?
Well, we're holding up. It is a challenging time. You know, a lot of my family is in New York, which has become a hotbed of the pandemic. But I'm happy to say, God bless, we're all doing fine and healthy.
Tell me about just kind of keeping in contact with your leadership team and the staff in this kind of situation.
You know, we were very fortunate because we began the deployment of Cisco WebEx systems, and we started practicing using those systems well before the pandemic to bring our organization closer together. And so we've been able to have our regular routine of incident management meetings on a daily basis with the executive team. Then we have our regular staff meetings, and we've been able to function very well operating remotely using technology.
A global pandemic is not something you can really anticipate.
Right.
I mean, you can prepare for hurricanes, you know those are going to happen.
Exactly.
So give me an assessment on how the authority is doing at this point.
You know, we get a lot of practice from those hurricanes, the seasonal weather issues that we have to deal with. This is much more, longer in duration. And so from an operational standpoint, we're doing very well. And I think it's a testament to the staff here, the operators, the maintenance personnel, our customer service personnel, and the infrastructure that we've built here at the JTA, that we've been able to function, I would say, rather well. We are carrying about 13,000 people on average on a weekday. We did see a significant drop in terms of ridership, but we've been serving our passengers well. On-time performance is just as strong as it was prior to the pandemic, and we're just greatly anticipating when this will be over.
I want to talk about not a new partnership, but a unique partnership that the JTA has developed over the last several months, but it really came to head here during this crisis, and that's with the Mayo Clinic.
Yes.
You have a situation where literally right in the middle of this crisis, you partnered with not only Mayo, but Beep and Navia to come up with a solution on how to expedite this coronavirus testing. Tell me how that all came about.
You know, it's exciting for us as the JTA, and I think it's part of the spirit of our organization, which is we see ourselves as being part of the problem solvers of this overall community. And as this healthcare pandemic faced our community, our work that we have been doing with Mayo previous to the pandemic, we were able to expedite that cooperation, that partnership, to deliver COVID-19 specimens from their drive-up testing facility, taking those specimens and using the autonomous vehicle and all the knowledge we've learned over the past 3 years to actually transport without transport those specimens to their laboratory. That frees up the healthcare professionals, frees them up to focus on patients and leave a lot of the transportation to us in terms of transporting those specimens. So we're very excited about that partnership. Didn't start overnight. You know, we had been working with Mayo along with some other facilities to start advancing autonomous vehicle technology here in Jacksonville.
How do you leverage what you've doing now during this pandemic with Mayo to future projects?
Exactly. Out of a crisis like this, it's those organizations that learn and they get creative and find different ways of doing business that will succeed and that will survive this unfortunate outcome or turn of events. And so we have learned a lot in terms of just the healthcare and safety for our customers and healthcare and safety for our employees. And so those lessons that we've learned, we will be deploying them as we go forward. It's a new normal, and we need to be prepared for it. But as we stand today, the JTA, I think, is doing exceptionally well in the face of it.
Let's talk about your frontline employees, the bus operators and the mechanics and the transit supervisors. They've done a remarkable job kind of handling things and keeping the city moving. Talk about them for a minute.
I can't stop talking about them because I think for the 13,000 people that we're carrying on a daily basis, those are individuals that, frankly, they are supporting our hospitals, they are supporting the grocery stores, and they're making sure that many of us can stay at home with the work that they're doing. our operators, our maintenance employees, our operations, customer service staff, they've done a fantastic job. They've given and they've sacrificed. I also, want to take a moment to thank all of the healthcare professionals, the doctors, the nurses, as well as, our firefighters and police officers. Our bus operators, the maintenance staff, they're all in that family of people who are sacrificing to ensure that the rest of us can maintain our safety and a good state of health.
Our community as a whole has been suffering economically, and JTA is not immune to that. I mean, if people aren't buying gas, there's no gas tax revenue, sales tax revenue.
That's right.
And not as many people, riding, so that hits you at the fare box. How can you overcome that?
So I think the strategy for the JTA going forward, working with our board of directors to provide us policy guidance, is to examine how we can strategically contain our costs. We do need to move our customers. We do have a number of construction projects that need to move forward, and I feel confident that we can continue to do that. But we do have to make smart decisions in terms of our funding and how we spend these limited dollars that we will be receiving until the economy turns back around.
Let's talk about kind of where we are right now in the Jacksonville Regional Transportation Center. Yes. We haven't really got to spend a lot of time here because of this virus. What's it feel like being in this building, knowing it's ready, and yet you haven't? No one's really got to explore it yet. No one's really got to use it yet. Talk about that both from an employee standpoint and also our customers haven't really enjoyed it yet.
Yes, well, we've made a decision that we will do a much smaller opening of JRTC, the operational bus operation portion of this facility. We will continue to have our non-essential employees, our administrative employees, work from home until such time that the pandemic is fully cleared and we feel it's safe for them to come and occupy this building. But our transit operation will move forward, and they will be relocating from Rosa Parks here to this facility. This facility has, from a technology and safety perspective, is a much safer facility. It's a much more efficient facility, and it has all of the latest technology to make sure our customers have a safe and customer-focused experience. I'd like to add one more thing. In terms of the JRTC, we didn't build it just for today. We built it for decades to come. And so this facility will be here for the next 50 to 100 years, and the citizens of this community will get more benefit. They'll get their full benefit of its construction going into the future.
It's easy to be disappointed because you didn't have that big grand opening, but with everything that's going on, you have to keep things in perspective.
Exactly.
Right?
It's more important for us to focus on social distancing and following the protocols laid out by the federal government and the state and our mayor. We're going to follow those protocols to ensure that everyone's safe, but at the same time, I'm going to reiterate, this facility is going to be here for generations to come, and there'll be the appropriate time for us to cut the ribbon and have a celebration for its opening.
Do you have a favorite aspect of the building and either inside or outside yet?
In terms of the building, I think just the location of it. I think the location on the west side of downtown Jacksonville, adjacent to the Prime Osborne, I think it couldn't be a more, and I'm looking right over your shoulder at I-95. It couldn't be located in a better location in terms of transportation and the connectivity that we need in our community. So the location is just, I think, the prime location for the JRTC.
And while this was going up, there's been a lot of things going up around it.
Exactly.
because of this building. You have the new lofts, and there's more townhouses to come, and there's other development just coming on line maybe in about a block away. So I mean, this really will be a hopping area.
Exactly. And again, it goes back to location. I think in the real estate world, it's location, location, location. And the JTA, along with the city, we have parcels in and around the JRTC that are available for development. And I'm excited about the future of La Villa and for the JTA to have a hand in its revitalization. It was a bustling community at one point, fell on hard times, and look, it's right about time for its resurrection. And so we're happy to be part of the anchor, a part of the foundation that created that resurrection.
Talk to our viewers about what they can expect after this crisis is gone,
Yes.
and look into the future about what are some of the exciting things that's coming from JTA?
Yeah, so we are working on that right now. We have identified a number of projects that are ready to, shovel ready to move forward in terms of our road program. Alta Drive, for example, San Pablo Road. So we have a number of road projects that we need to break ground and get them moving. Kernan Boulevard is wrapping up, so now we're moving from Kernan to San Pablo and Alta Drive. I would say the work that we need to do in and around the ferry. There's another ferry grant that we received earlier this year that will help us with revitalizing and upgrading the ferry facility. And then First Coast Flyer, what's going to be called the Orange Line. We need to begin construction on the Orange Line that will take us to Orange Park Mall and connect to this facility right here, along with more autonomous vehicles and the U2C program, the Bay Street Innovation Corridor. We've got our hands full, and so the sooner we get through this pandemic, the quicker we can get back to our construction activities. And so it's an exciting time. We just have a little decline here, but the future is bright.
Sounds exciting. Can't wait for it.
Oh, yes, it is.
Thanks for taking some time for us today.
Thank you, Bill.
It's undeniable that our healthcare workers are true heroes in this fight against the potentially deadly coronavirus. We also need to include JTA bus operators, maintenance workers, and supervisors on that list. Every single day during this crisis, JTA has asked its employees to provide transportation to thousands of people in this city. And every day, they continue to show up to make those trips for you. So why do they do it?
Anybody who's out here working in any field, police officer, firefighter, we all got to be a team now.
Well, it's a privilege to be working because we get a chance to help people, and to be honest, we're in a safe environment. They provide us with equipment to be safe and make sure the passengers to be safe, with the buses being clean and sterilized every day.
It could be frightening sometimes, but I know I have to come to serve the public.
In this time when you know people depending on you, it make you feel special.
So a huge thank you to our devoted JTA heroes who have kept our city mobile during this crisis. At the top of the show, we told you about the innovative solution JTA and the Mayo Clinic created to make coronavirus testing safer and more efficient. Well, that's not the only unique virus-fighting effort coming out of the JTA. A team of JTA planners and engineers used an in-house 3D printer to make face shields that would better protect the authority's utility workers. Making Moves videographer Carlos Bouvier shows it how it all came together and what the workers thought about their fellow employees finding a creative solution to help keep them protected.
So, by them taking the initiative and looking out for our safety, it's very appreciative. It feels real comfortable. It's not snug or anything like that. You can barely tell that it's on. It's just like you got a baseball cap on.
We have an incident management team who has put a lot of time and effort daily into looking at ways in which we can keep our personnel safer. So this is a 3D printed face shield made of various plastics. We have a couple of 3D printers here in-house at the JTA, and so we were actually able to make these shields for some of our frontline maintenance personnel through the 3D printer.
It really stemmed from a need to kind of alleviate some pressures from the pandemic for mostly our maintenance and facilities teams that are currently still at work.
Took a few initial rounds on the 3D printer, tested and refined it, and we're giving these out to our maintenance personnel just to add an extra layer of protection.
It's really just a 3D printer, pretty standard. It uses plastic filament to print 3D models, heats up the plastic and then extrudes it onto a plate surface. Right now we utilize it to print models of kind of buildings or areas as part of our transit-oriented development program. So we utilize this model versus other models because it utilizes pretty commonly accessible office supplies. Even the filament is still readily accessible, and then all the other supplies are either in the office now or can be here within 2 days. So we have the ability to utilize office supplies that we already had to create these shields. And I think that with the cost, including the filament and the face shields, it comes out to something less than $2 a mask. So the 2 major components are attached via a rubber band, then allow the headpiece to stretch. And then the face shield, the plastic shield, is actually made out of like binding cover. So it's a clear plastic sheet. We're just really looking to help any way we can. First and foremost, we want to keep our employees safe. But then also, if there's any way we can help alleviate the hospitals and the staff there from the pandemic, then we're willing to do anything we can.
It's just another example of how we at the JTA are using innovation in every way we can. Kind of everybody's working for a common goal to keep our operators and other frontline personnel safe.
The coronavirus hasn't slowed down JTA's Mobility Works program from expanding Jacksonville roadways. On the west side, JTA is busy reconstructing Collins Road between Old Middleburg Road and Rampart Road to 4 lanes with raised medians, bike lanes, a closed drainage system, and new sidewalks. Phase 1 between Old Middleburg Road and Schindler Drive is expected to be completed this summer. The remaining portion of the project, Schindler to Rampart, should open this time next year. Meanwhile, good news for those who use Kernan Boulevard. The work on Kernan is substantially complete, several months ahead of schedule and under budget. The new roadway has raised medians, curb and gutter, sidewalks, bike lanes, utility improvements, and a 12-foot multi-use path on the east side of the road. JTA will officially open Kernan Boulevard during a virtual ceremony on Thursday, May 14th at 10 a.m. The coronavirus has devastated much of Jacksonville's small business community, some closing temporarily, with others shutting their doors forever. Local restaurants have transitioned from sit-down establishments to takeout and delivery only as a means to keep some income flowing in. Well, JTA found a way to not only thank the hardworking staff at its Myrtle Avenue operations campus, who have been keeping the city moving during this crisis, but also help some Jacksonville restaurants at the same time. Popular local restaurants all provided over 400 box meals as part of this unique JTA food program. The restaurant said such a large order like the one from JTA really helps offset some of the losses that they've incurred due to the virus.
That's a significant amount of business that would have been, easily would have been our busiest day ever. So to be able to get an order like that is fantastic for our continuing strategy of surviving the month and then advancing to the next month.
We're very fortunate to be one of the ones that JTA did reach out to have their trust to pull something like this off.
Over the course of the 6-week program, JTA expects to purchase around 5,000 meals from the participating restaurants. The food program is part of the JTA Cares initiative that has also supplied clothing and other amenities to homeless veterans and other needy members of our community. JTA worked with the Jacks Chamber, Help Local Thrive Again, and its own disadvantaged business enterprise team to identify participating restaurants. What a great thing. And that wraps up this edition of Making Moves. Be sure to join us next month when we'll have customer reaction as they experience the new JRTC for the very first time. In the meantime, we welcome you to check out our YouTube channel where you can watch past episodes and stories at your leisure. A direct link to our page is available on JTA.com. You'll also find stories and other exclusive content when you like our Facebook page at facebook.com/JTA Making Moves. For the entire Making Moves team, I'm Bill Milnes. Thanks for watching and stay safe, everyone.